how people get shot.
All right, 6 feet. Get your pictures. That's what you're getting. Yeah, perfect. Andy. Oh, Miss Eleanor. Yes, Kathy. Okay, right there. Okay. No, that's Carico. This is Ruth Carico. I just want you guys to know.
Oh, yeah.
Right? Yeah. Fatty fangs under the air.
I love it. Is it time to start?
See, Ruth, you haven't spent much time with Sherry, but that's what she
It's
thinks
exactly
about
10.
you. No, you can't stand behind it. That is great. So, all right, well,
It looks like.
okay. Okay, sounds good. Just tell me what to do. Just tell me what to do. I'm a wind-up doll. All right.
Am I good? All right, good morning, everyone. Welcome and thank you for joining us today. Dr. Sarah Moyer, I think you all know me by now. We are now at the end of our 12th week of operations here at LouVax, and I'm so far so proud of all the work we've accomplished in getting the vaccine to members of our community each day. As of today, nearly 30% of all Louisvillians have received at least one dose of the vaccine, and 37% of people over 16. And we're seeing that number grow every day. This is great news as COVID cases have declined for 10 consecutive weeks. But the fight's not over. Case counts have plateaued some in that accelerated orange category. So it's a great reminder that everyone traveling for spring break to get tested before you leave. It's not too late. And then 3 to 5 days after you return. Remember to pack your masks, avoid large crowds, especially places like bars and restaurants where mask wearing is not possible. And other really good news, this week the Biden administration announced its new goal to administer 200 million shots during its first 100 days in office, after reaching the initial goal of 100 million doses on day 58. They've decided to double its target. So this pace of vaccination has continued to increase daily, and we're seeing that here where we're far outstripping our original goals of having everyone vaccinated by the fall. So Dr. Hartledge is going to provide an update on our progress here at LouVax and the amazing work done that would not be possible without our staff and volunteers in just a bit. Just a reminder that it's really a modern day miracle that just 1 year after the pandemic started, we now have 3 vaccines available that are effective at preventing serious complications from COVID, including illness, hospitalizations, and death, as well as helping us to slow transmission rates in our city so those that can't get vaccinated are also protected. So please, if you have not signed up to get vaccinated yet, check out our website. If there's no appointments, put your name on that Norton wait list, and somebody in the community will get back to you in a few days in time to set up an appointment. A reminder that 1C includes many job classes as well as a long list of medical conditions, including a BMI of over 25 for a 6-foot male. That's anyone over 180 pounds, and 5'5", that's just 150 pounds. So anyone who is over 16 and meets those requirements can sign up now. If you need assistance, call the Lou Health COVID helpline at 502-912-8598. I'd like to thank our guests this morning, Delnor Manson, CEO of the Kentucky Nurses Association, and Andy Patterson, Director of Homeless Services at Family Health Centers. They're going to talk to you this morning about vaccine efforts through mobile missions in the community. Vaccinating everyone is how we're going to stop the spread of COVID. There's been a lot of effort towards vaccinating our medical first responders, essential workers, seniors, and many others. These mobile missions are another effort to reach populations that have different challenges than the rest of our community. We want to vaccinate everyone in our community who wants a vaccination. And while these drive-through mass vaccination sites are very efficient, we know that they're not easy and convenient for all residents of our community. Mobile missions are important because they allow us to meet our citizens where they are and do all that we can to prevent COVID-19 among our homeless population. To give us an update on how vaccinations are going with the homeless, including mobile missions to encampments, is Andy Patterson, the Director of Homeless Services for Family Health Centers. So Andy.
Thank you, Dr. Moyer. Hi, everyone. If you're not familiar with what we do at Family Health Centers, we have 8 clinics located throughout the Louisville community. One of those, which I direct, is called the Phoenix Healthcare for the Homeless program. We're the only clinic of its type in Louisville, and we exclusively serve homeless individuals. Luckily, we were able to get the Johnson & Johnson 1-dose vaccine from the health department almost 3 weeks ago, and we started administering that vaccine on March 9th. As of yesterday evening, we had vaccinated 303 homeless individuals. Also last week, Norton Healthcare and other community partners went to Wayside and Salvation Army shelters and vaccinated 275 people in those 2 shelters. So in total, 578 homeless individuals have been vaccinated through our efforts and the efforts in those 2 shelters. We did do our first vaccination at a homeless encampment on Wednesday, and were able to vaccinate 15 individuals in the encampment. We went to St. Vincent de Paul's shelter last night and vaccinated 35. And we have plans to do another shelter and another encampment next week. So the estimated homeless population at any given time is around 1,200 to 1,500 in Louisville. So at this point, we've vaccinated about a third or so, or even higher of our population. So we're very pleased with the reception that we've been getting from our homeless neighbors to take the vaccine.
Thank you, Andy, and thank you for all the amazing work you're doing to make sure everyone in our community is vaccinated. To tell us more about how one of our key partners, the Kentucky Nurses Association, is going to help with mobile missions, including one coming up tomorrow, is the CEO for KNA, Delnor Manson.
Good morning, everyone. Just to let you know that the Kentucky Nurses Association, there are 99,000 nurses in the state of Kentucky and about 13,000 in Louisville. So far, we have been what I call an anchor partner with this vaccination and testing. And we did our first pilot mobile mission, which is, as Dr. Moyer said, designed to take the vaccines to where people live and work. On Thursday at the CTS Russell, we did 95 vaccines in about 2 hours. It took about 13 people in 2 days to stand that clinic up, but we got it done. A lot of community partners want to be involved in the vaccinations, and we appreciate that. But it takes a lot of effort to stand up a clinic, a mobile clinic, and just want to remind people that it is not as easy as it sounds, because we know people are well-meaning. However, it takes a little bit for us to make that happen. We are planning another clinic tomorrow at Hope Wellness Center from 10 to 2. We're expecting a nice turnout. With the CTS Russell, it was kind of interesting because, of course, everybody's masked up. But you could see in the eyes, the smiling eyes is what I call them, when they were saying thank you. We also had an opportunity to do some education regarding the vaccine, because we did have some people who were reluctant to get the vaccine. They wanted it, but they just weren't sure. So as nurses do, we spent some time doing education and making sure people were comfortable with the vaccine. I want to encourage everyone, as Dr. Moyer said, to continue to get the testing. Testing is down. However, if you are engaging in any of those groups that Dr. Moyer mentioned, we encourage you to get the test before you engage and after, so that we can find out if you are a person who might infect other people. Thank you.
Thank you, Delnor. Amazing work going on, and as we work to get our entire community vaccinated. And now to give an update on LouVax and our amazing volunteers and staff is our Associate Medical Director, Dr. Sarah Beth Hartledge.
All right, so as usual, I'm going to start with our data update. Here at LouVax, we've now given 46,683 primary doses and completed series for 24,591. for a total of about 70,000 doses given here at this site. Across the metro area, there have been 243,830 primary doses, which represents about 37% of the population over the age of 16. And 129,294 people have completed their series, which represents about 20% of the population over the age of 16. Here on our site, as you know, we depend on our volunteers and we love having them here with us. We now have a total number of registered volunteers of 6,869 who have given 60,316 hours of their time with an estimated economic impact of over $1.6 million. We vaccinated our 1,000th volunteer this week, so we have now given 1,061 doses to volunteers. Our volunteers of the week are always difficult to choose, but this week I have a group here with me. First, I have Faith Morris, who was nominated for, she was the director at the end of the exit ramp out here, and she was cheering folks on as they exited the arena headed to the observation area. I have Faith. I have Audley Gordon, who is one of the elite club who has worked in all 3 of our zones here. Not everybody takes the opportunity to explore the whole site. Thank you. We've had a number of our early days volunteers from January who've come back to us and rejoined the effort. And one of those is here with me today, Mary Wilson. I have Luann Diddalot, who's a blue vest person. She's on our clinical leadership team and helps get all the questions answered on the floor and make sure everyone has the tools they need to do their work. And then finally, I have Teresita Wisdom, who is a nurse and an injector, and she is someone who's always looking for more ways to help, always asking what else she can be doing to participate and help the effort overall. And then finally, our staff member of the week this week is someone who helps organize our volunteers, make sure they have everything they need, someone who gives you all your green vests when you enter here too. So this is not just a volunteer role, but also someone who helps organize everyone who comes in our front door, and that would be Travis Byerly. So looking forward, starting Monday, as the governor announced yesterday, all phase 1A, 1B, and 1C folks remain eligible. 1C including essential workers and those with comorbid conditions. As Dr. Moyer said, that's a very large list that does encompass a lot of people. But the governor announced yesterday that all adults age 40 and up will be eligible for scheduling starting Monday. So all of our local providers will be following that guidance. There are a lot of different ways to register, many places you can get a vaccine now. The best place to get your most up-to-date information is either to check our website at louisvilleky.gov/vaccine or to call the helpline where they can also help you register if you don't have internet access. There's been a lot of talk about mobile missions, and that effort continues to scale up. We're excited that we should be receiving an additional shipment of the Jansen vaccine this week. We got our first shipment about 3 weeks ago. It was 1,500 doses. There are less than 100 of them left, and those are scheduled to be given in the next couple days. So that initial shipment is essentially completely depleted. So we're excited to get some more and be able to expand the mobile missions and other projects in the community to be able to, as Dr. Moyer said, meet people where they are, and happy to partner with the Kentucky Nurses Association to run several of those mobile missions and pop-up clinics. And I think that's it, so I will go ahead and take questions. Go ahead.
That's a big question. Typically, whenever one camp shuts down, it moves somewhere else. And our outreach, we have outreach workers that work with us, and then there are lots of grassroots and nonprofit outreach groups, and we pretty much go wherever the people are. So, and we're looking to find creative ways to get to the encampments, because just from a capacity perspective, we can easily go to a big encampment, but when it's a really small one, we're trying to find ways to maybe get to those folks and bring them into the clinic. So we're thinking of any ways possible to get out there and meet people where they are. There's a group of outreach workers that I'm included. We get an email when there's a notice. So as soon as they post a 21-day notice, a bunch of us are on an email list and we get that notice. And so they ask that outreach workers and agencies go out and help these folks and advise them that there's been a 21-day notice. Yes.
I saw at the beginning of COVID some paperwork from the city that said in the COVID policies that we should not be breaking up homeless camps at this time, that we should not be leaving camps during COVID, that we should not be disseminating people around town because it would encourage the spread of the virus. At what point did that policy change? At what point did that rule stop?
I have not been involved in any of those discussions, so I don't know.
Any other questions? No. Can you come up closer? So the question was, will the new shipment of Jansen next week be the same size? And yeah, we're expecting 1,500 doses to come in, and expecting 1,500 every week after that to help with our mobile missions going forward. Yeah, so originally we thought it would be next year. I think with the increase in doses, anybody who wants a vaccine could be vaccinated that's over the age of 16 by May. I think the difficulty is going to be these last 3 months we've gotten everyone who's wanted it easily done, and so our job's going to get harder going forward trying to get the last 25% vaccinated. I don't have a timeline. Do you have a timeline? No, not really. I think it's going to depend on how perceptions change and getting those last 20% vaccinated.
What are the chances that students will be able to get vaccines over the summer in time to return to school in August?
So anyone over 16 now can get vaccinated. If they meet those categories, we think when we get to phase 3, that'll open up more. But those under 16, it's going to depend on trials and when the FDA approves that for EAU use. But hopefully at least 12 and over by August.
This is a pretty big eligibility expansion. What kind of problems do you foresee, if any at all, as far as logistics or even just getting the shots in the arms of this many people as you open up eligibility this much?
Yeah, so eligibility was to age 50 this week. It's going to open up to anyone 40 and above on Monday. So not a huge jump. So hopefully there's enough appointments. We're starting to see we have enough doses that it's been slower, those appointments filling up over the last couple weeks than it was initially. Whereas it initially took minutes for all the appointments to fill, it's taken a few days now. So hopefully those will fill quickly.
So you don't foresee that 10 years making that look different?
Hopefully not, because we think 75% of Kentuckians, probably at least 75, fell into that 1C category. So there's not that many more that are getting added with the age addition.
And kind of pulling out Mark's question, part of it you mentioned was it would be kind of starting to get difficult to get that last like 20% or so people vaccinated to achieve that herd immunity. What are some of those challenges that you're talking about that may be difficult to
So access is one reason, which is why we're trying to increase our mobile missions that are going out, make sure everyone has access and the ability to get vaccinated. And with more and more Jansen being available now, we're hoping to increase that. I think others is just some people have more questions that haven't been answered or need to see more friends and family members vaccinated. And so hopefully that'll kind of snowball and we'll get more and more vaccinated going forward. Thanks. Thanks.
I need a group picture.
Congratulations, guys.